Next slide, please. The CALL series is part of an initiative to identify and foster adoption of innovation and promising practices on this topic. This work is made possible through the generous support of the John A. Hartford Foundation, which works tirelessly to improve care for older adults, and the Cambia Health Foundation, which is dedicated to improving the way people experience healthcare. Access to the COVID-19 vaccines for older adults is being prioritized across the country due to the vulnerability to more serious illness from the virus among this populations. However, for the estimated 15 million older adults and individuals with disabilities who do not leave their homes, access is challenging or impossible. These challenges are not well understood, but government agencies are beginning to attend to these challenges as the vaccine supply increases. State and local health departments across the country, working in partnership with the Aging Network, hospital systems, and other community partners, are turning their attention to this population, and a variety of innovative and practical solutions are emerging. We're all learning together at this critical moment. These huddle calls are designed to share just-in-time or just learned information as broadly as possible. In studying this topic, we are seeing some themes emerge. Over the course of this call series, we expect to touch on each of these themes from various perspectives. This graphic depicts these themes as separate ideas. However, in practice, they are interwoven and interdependent. A change in resources or implementation strategies in one area has a ripple effect throughout the system. Today, we will hear from Donna Walsh, Health Officer for the Florida Department of Health in Seminole County, who will speak about her agency's experiences in getting the COVID vaccines to those who are homebound and their caregivers, as well as other observations and innovations related to vaccine distribution. After her remarks, we'll open it up for questions and discussion. Over to you, Donna.
Thank you so much, Margie, and good afternoon, everyone. Thank you for this opportunity. I welcome the opportunity to share with you some of the practices that we started early on with vaccine distribution to our community, with, of course, our state of Florida and our governor's office making those who are 65 years of age and older priority in our state. Certainly, we also have included caregivers just recently, I'd say within the last couple of weeks. But we also considered caregivers when we made our home visits. So to kind of give you some current information on what's going on here in Seminole County, our population is around 488,000 in total for all of our residents here in Seminole. We are the third most population dense county in the state. So we are a geographically smaller county. And we do have, of course, we're a bedroom community to Orange County, which is just to the south of us. So far, we have vaccinated 114,581 Seminole County residents and administered 176,085 doses in total. If we look at the age distribution, of course, our state, in line with many states, actually went step by step with opening up the priority areas by age group. So, you know, we had opened up to the 50 years and plus a couple of weeks ago. So we've vaccinated about 31% of our population in the 50 to 54-year-old age group, 33% in 55 to 59-year-old age group, 47% in the 60 to 64-year-old age group, and 65 plus is 65%. So where does that leave us with our homebound, you know, community? Very first day that we started to administer COVID-19 vaccine, we received 8,100 doses from the state to support the state mission of entering our long-term care facilities, nursing homes, and ALFs and group homes to support the statewide effort with CVS and Walgreens. And we were told that support was not needed, and so we utilized our 8,100 doses of Moderna for the 65 plus population and our homebound population. So our very first day of administering vaccine, we were making home visits. And we did that because we have a pre-existing program called Community Integrated Mobile Health Services. And that service team is comprised of an RN, a registered nurse, and some community paramedics, or health educators, who routinely provide health screenings for chronic diseases such as diabetes, cardiac disease, mental emotional health, and others, as well as infectious diseases such as STD, HIV, and of course, COVID-19 testing. That group has been instrumental in testing people in their homes, as well as providing vaccine. And of course, that group also makes referrals to our partner agencies in the event that, that they identify additional needs and what we can provide. That team also delivers food boxes to those who may have food insecurities, with our Seminole County Emergency Management in partnership with them. In fact, from the very beginning in testing folks for COVID-19, our emergency manager was forward thinking, and he put together a team to contact everyone in isolation and quarantine daily to make sure that all their needs were met, whether they be homebound or otherwise. Well, technically, when we put them in isolation or quarantine, they're homebound, right? So knowing that those social determinants of health continue. And so what we have done over time is to increase our home visits with our partnerships. To date, as of yesterday, we have made 1,089 home visits, just our county alone, with this particular team in support of the county paramedics. The paramedicine program has been instrumental and critical in our efforts to make home visits daily. So I know that I've often been asked, well, how do we even know that these home visits are necessary? Well, the county still has their emergency operations center activated. Their call center receives calls from people who are unable to drive to one of our pods. There is a triage on whether or not they would qualify for our homebound services. And so a series of questions, just a few questions to ask, would they be able to make it to one of our vaccine pods? If not, certainly we're more than happy to go out to their homes to provide the vaccine to them as well as their caregivers. And so we also have a call center here at the health department. We receive phone calls in that manner as well. And then within the last few weeks, we've reached out to all of our home health agencies and identified 41 additional individuals who need home visits, and working with our home health agencies. Fortunately, many of the folks who do receive home health care had already been visited by our team. We've also reached out to almost 2,000 registered special needs clients in our community, and this is, our emergency operations center, their team, and did this within the last couple of weeks. And we're identifying those individuals who may not have already taken advantage of our homebound services. So currently, we started out with Moderna. We've been giving Pfizer. We do have the ability and the resources to store Pfizer at the ultra cold temperatures. So we have been getting mostly Pfizer. We have requested Johnson & Johnson vaccine in transitioning to our homebound services, because only one vaccine is necessary. So certainly that makes it easier for the client as well as for our team. And we utilize our homebound team also to visit our nursing homes, long-term care facilities, and group homes in ALFs routinely as they admit new residents as well as recruit new staff. So this is an ongoing process. We have recently also recruited some agency nurses in coordination with the county emergency manager, who has contracts with some agency nurses to provide the service as well. So far, we have also done about 40 outreach events. Now, these outreach events are not considered homebound, but certainly we have been very strategic about opening up vaccine pods in areas where we know people maybe have difficulty traveling to our fixed vaccine pod. And we've also, very beginning of our vaccine efforts, identified our 55 plus communities and made sure that they were provided vaccine. Of course, that was 65 years of age and older. Now it's time to revisit some of those communities as our priority groups open up. Effective April 5th, or Monday here in Florida, anyone that's 16 years of age and older, of course 16 to 18 for Pfizer and 18 and older for Moderna and Johnson & Johnson, can receive a COVID-19 vaccine. And so, we are looking at revisiting some of the areas that we initially visited when there was a higher age group in the priority area, just to make sure that everyone receives an opportunity to get the vaccine. We this week visited one of our underserved communities, uninsured and underinsured, in Goldsboro with our vaccine trailer. So we have a mobile vaccine unit with 3 compartments that we're able to provide vaccines in coordination with the Boys and Girls Club. So those are the sorts of outreach events that we do, but also our faith-based organizations, community centers, and so forth. So at this time, Margie, I can pause a moment to take questions and would be glad to do so.
Thank you so much, Donna. And I'll ask if we can just have the initial questions up on the screen, but invite everybody who may have a question. Feel free to raise your hand in the chat and let us know so that we can call on you, or feel free to just chime in when the time comes. Sorry, my screen is not cooperating. Come on, there we go. Okay, well, I'll kick it off. I mean, you mentioned a few connections and partnerships that I've not heard before. Donna, you talked about the Boys and Girls Clubs. That's not one that we had heard about before. So I guess the broader question is what kinds of new partnerships and collaborations are happening in Seminole and across Florida that you're aware of to try and help support this effort?
Well, one thing that I did not mention is after Seminole, and I know some other counties within the state started a homebound program. I know that Manatee County in particular also has a community paramedicine program. Our paramedics, the partnership with our paramedics has gotten stronger and closer. We honestly could not achieve what we've been able to achieve without their support. The state has also adopted this model. They've deployed incident management teams at various counties throughout the state to provide homebound services as well. So knowing that some of our rural counties and counties with less resources would be unable to replicate the model that I just described. So the state, emergency management has also deployed teams in order to provide these services. Boys and Girls Clubs, are federally qualified healthcare centers, our nonprofit medical facilities such as Shepherd's Hope, here that services Central Florida. The partnerships that we had formed, just in our public health operations day to day, have just become stronger through this response. And it's laying that foundation or groundwork, developing those partnerships before an event like this occurs that has been so valuable. So, the partners that we previously had certainly continue to be there for us. And it's just amazing as we've given vaccine in our pods, how retired medical personnel, whether they be doctors, a veterinarian approached me the other day, but doctors, nurses, and so forth, they would just like to volunteer with us. They're not even interested in getting paid for their services. They just love to serve the community, and we have recruited quite a few.
Fabulous. Well, I'll continue to invite our attendees to jump in with questions that you may have for Donna. And seeing no hands raised, I'll just continue to ask. So you mentioned about the volunteers not even needing to be paid, but surely surely there is an elaborate payment structure in place for those who do want to be paid. I'm thinking about your the agency nurses that you mentioned. And the others who are joining this effort. How is that happening? Is it all happening through the health department, or are there other funding mechanisms that are being employed?
Sure. Well, as you're probably aware, the federal government has provided funding for our response through epidemiology, investigations, contact tracing, and as well as our immunization efforts. And so, honestly, local public health departments don't have the funding to be able to do that. So we're very grateful that additional dollars came our way in order to provide those services. So yes, it's really federal funding that's supporting the recruitment of additional staff, along with our county. Our county government also received funding to respond to the COVID-19 events. And so they have coordinated contracts with agency nurses as well. So it's happening at the local level, county, as well as the state level. The state level has deployed agency nurses to support our vaccine efforts in our fixed vaccine pods, and then the county for our homebound team.
Marvelous. There is a question here from Karen Chapman. Karen, do you want to unmute and share?
I didn't know we could do that. Hi, Donna. I actually
Dr.
been
Chapman.
started with Donna, and so I know her well. So Donna, just something I've been trying to get a handle on is our homebound program worked through the home health agencies, and they haven't been extraordinarily forthcoming with getting us getting us names. But part of the process was they would get the signed consent, and then they would send it in to EMS, and EMS would go out. Now I'm wondering if that hasn't been a barrier, and wonder, do you do a phone screening form of the clients and caregivers, making sure they don't have any absolute contraindications? Do you get the consent signed at the visit? And do you have like a separate team that stays for the observation period?
So those are all great questions. Let me see if I can remember them all, Dr. Chapman. This is a memory test, right? Okay.
Oh, okay. Well, do you pre-screen them on the phone first?
We do.
And you have a questionnaire that you use?
Absolutely. So, early on, we were doing just brief screenings. We have a designated team, our Community Integrated Mobile Health Service team, that screens the referrals. And so initially, we discovered when we were going out to home visits, folks, would just sign up and they were out mowing their yard. Okay, so they really didn't need a home visit. They were just trying to get an appointment, and it was challenging, no doubt, with the Eventbrite system and the appointment system that was set up. So we adopted the HHS screening form. And if you would like, I can forward that along. So that has assisted our triage team to determine whether or not somebody truly needs a home visit, or if they just need assistance navigating the appointment system, which we're more than happy to do as well. So yes, we use a screening form. We also like to prepare the forms for the paramedics prior to their home visits. So we've learned that along the way too, that if we prepare the consent forms as much as we possibly can beforehand, then they take that form out and the caregiver and or the patient sign those directly in the home.
Okay. And
Margie, if I can ask, oh, go ahead.
Well, how do you manage the observation period, given the time frame for vaccine?
Well, and we do that in the home too. So the vaccinators, the paramedic, the nurse, they will actually stay in the home for that 15-minute period of time. And so we have at least 2 separate teams that go out on home visits every day. And sometimes they visit 30 to 40 homes a day.
So Donna, do you pre-draw from the vials and then send the individual syringes out so you can send out multiple teams? Or are they drawing it up in the field?
They're drawing it up in the field. They've been well trained to do so. They've worked in our fixed vaccine pods for weeks. So these folks are very familiar with the storage and the handling of these vaccine and vials, and the Pfizer with the diluent and mixing it up and knowing that they have within a 6-hour period. We equip them with the coolers with a temperature gauge. So these are hardened coolers that they take out with them. They also have a smaller cooler with a electronic temperature gauge on it. If they just want to take a couple doses into a home, they don't have to pick up the large cooler that's in their truck. But then the smaller cooler, and again, if you're interested, I can send you the vendor where we ordered these items from.
Great, thank you, Donna. Appreciate any of that information would be wonderful.
Great.
We can also follow up and provide links to the HHS screening form and any other information that Donna wants to share. We can pass on to those of you who are on the call. I think Jane, you had a comment?
Oh, Donna, thank you so much. This is just so excellent. And some of the questions that Karen asked is what I was thinking about too, just in terms of sharing with others. But Donna, I was thinking, we heard from Robin Lipson in Massachusetts. Was that just this week, Margie? Or yeah,
it was last week. Yeah.
Last week, and she talked about when they opened up their triage or their screening center, they had 900 calls that first day. So I wanted to know how many calls you're managing and what I say, is the community excited about this? Are they thankful, they're grateful, or are they just how the community responds to maybe all that you're doing? And we so appreciate it.
Sure, sure. I will say we're not getting 900 calls a day, but we're getting a fair amount. And as I mentioned, our county's been very supportive in taking those calls. So they keep a spreadsheet of every request that they receive. Those spreadsheets are then shared electronically with our community integrated mobile health service team, who then has the call center contact these individuals and conduct the screening. And then the folks have been ever so grateful for the home visits. They've been in tears that, you know, they've been able to receive a vaccine. And so, you know, the requests continue to come in. I, you know, fully anticipate as the age groups open, we might get even more. We also made arrangements with Children's First, and this is a group that takes care of children with disabilities in their homes. We did home visits with those folks as well. There were close to 30 individuals that we were able to provide vaccines for in the home. So very well received. I'm looking at our data here. You know, our 55 to 69-year-old age group, we've vaccinated 25 in the home, 70 to 79, 680. 80 to 89, 305, and 90 to 99, 76 home visits. And then we've even vaccinated individuals over 100 years old, three home visits. So, so that kind of gives you an idea of the distribution, but very well received, and folks are very grateful.
We have a question from Katie Scott. Katie, you can unmute. Can't hear you, Katie, but she says she can't. All right, well, I'll read your question. So the question from Katie is, are your volunteers under the Medical Reserve Corps, or do you have agreements with community partners, or both?
Sure. Not under the Medical Reserve Corps. We do have agreements with community partners here in Florida, and I'm not sure if this is the same, you know, nationwide, but in the state of Florida, our nonprofit organizations submit for sovereign immunity through the state Florida Department of Health, and then of course the local health officers sign off on that once their background screen and licensure is confirmed. We also have an agreement, and this again is a statewide agreement with paramedics. That was a template was developed early on in the COVID response for them to assist us with testing and now with vaccine. And so, you know, we do have a formal agreement with our county medical director, who actually oversees all the paramedics in the county as well as the 7 cities here in Seminole County.
Wow, super. I'd like to ask a sort of a broader question about the long-term impacts of all of these efforts and partnerships, and what you think the impact will be on public health practice in Seminole County, maybe in public health generally, but obviously you can speak to the local experience.
Sure. Well, having lived through H1N1 in 2009, I think that was a preview of what we are seeing today. I don't know that any public health, you know, professional envisioned that we would be here over a year later, you know, still at full response. But as I mentioned before, the partnerships that we had already developed have just strengthened with this response, and it's opened the doors to more opportunities. There are federal grants that have become available due to this response, and really focusing on health equity. And making sure that we do, as public health has transitioned over the years, address the social determinants of health. As we're going out on our home visits, our community integrated mobile health service team is very accustomed to doing screenings for food insecurities, for perhaps anyone who may need referrals to substance use disorder, counseling and rehabilitation. So they're out there with public health glasses, if you will, right? Looking at the whole picture and what other public health services these individuals may need, not just focused on the vaccine. And so I would envision that with the federal grants that have become available, many of our community partners are joining to address health equity with the vaccine, as well as expand that later on. We're actually connecting different partners together. Coming up is creating Peace and Justice Institute through the Valencia Community College or State University. They are putting on, I think this is their third annual, creating a resilient community from trauma to healing. And even with that, I've been able to connect partners from universities, speaking of epigenetics, to, to our partnership with the Advent Hospital System in their Hope and Healing Center that's opened up, and the Health Department NACHO grant, and joining those efforts with the Sheriff's Office to address, opioids and other substance abuses. And we certainly have seen an increase in substance use as people are looking to those coping mechanisms during this very difficult time. So I can only see more possibilities and more doors opening as a result of our strengthened partnerships.
Well, your optimism, your positivity, and your energy around this is very clear, and it's quite an inspiration. Let me just check in with everyone on the line if there are any other questions, comments, conversations you'd like to enter into.
Margie, this is Karan. I have a question.
Sure.
Hi, Donna. Thank you again for sharing with us today. This is very interesting. I wanted to know about the communication methods to let people know about the community events and the vaccine pods. Like, how did you get the word out that these were happening?
So a number of ways. We still have our dashboard, our website, and the county maintains a dashboard that the community can link into to look for our vaccine events. There's also, and I think I have shared this with Tifa before, but I can share it again. On our website, you can see, actually, it was probably Ripple Effect that I shared. On the dashboard, you'll see information on homebound services. So there is a section of that dashboard that addresses how to make appointments if you have difficulties navigating the Eventbrite system, who to call, the Citizens Information Line. And if you are requesting a homebound service, there's information on how to do that as well. We also have press conferences frequently. So this information is shared openly in press conferences. And so there's a number of, and then our social media, the county utilizes social media to get the word out as well.
Thank you so much. That's fabulous. And I see that we are approaching the end of our time. So I'll just go to the final slide here. Thank you for that wonderful information and conversation today. We will be sharing the slides and the recording following this event, as well as other information that we can squeeze out of Donna before she goes off for her weekend. TIFA is going to continue to hold these 30-minute huddle calls on Wednesdays and Fridays on topics related to enhancing access to the COVID-19 vaccines for people who need them administered at home. And our next call is on Wednesday, the 7th of April. Our featured speaker will be Dr. Tom Lally from Bloom Healthcare in Colorado. We hope you'll join us and spread the word to colleagues as well. And I have just pasted the link to the registration for the April series into the chat. Thank you, Donna, so much for sharing and your time and your knowledge with us today. And thank you to everyone here for all that you are doing. Take care.
Thank you. Stay safe and be well.